The neonatal period includes the time from birth through day 28 of life. During this time, the neonate must make many physiologic and behavioral adaptations to extrauterine life. Physiologic adjustment involve establishing and maintaining respirations, adjusting to circulatory changes, regulating temperature, ingesting, retaining and digesting nutrients, eliminating waste, and regulating weight. Behavioral adjustment involve establishing a regulated behavioral tempo independent of the mother, involving self-regulating arousal, self-monitoring changes in state and pattern of sleep. Behavioral adjustment also includes processing, storing, and organizing multiple stimuli, and the neonate will also establish a relationship with caregivers and the environment. The major adaptations associated with the entire transition to extrauterine life occurs during the first 6 to 8 hours after birth. The predictable series of events during the transition are mediated by the sympathetic nervous system and result in changes that involve the heart rate, respirations, temperature, and gastrointestinal function. This is a time of vulnerability for the neonate, and careful observation by the nurses is required. There are 3 stages the newborn will transition through. Stage 1 is known as the first period of reactivity and lasts up to about 30 minutes after birth. The newborn's heart rate increases rapidly, about 160 to 180 beats per minute, but will decline after about 30 minutes to a baseline of approximately 100 to 120 beats per minute. Respirations are irregular with a rate between 60 to 80 breaths per minute. Fine crackles can be present on auscultation. Audible grunting is noted, nasal flaring, and retractions of the chest can also be present, but these should cease within the first hour of birth. The infant is alert and may have spontaneous startles, tremors, crying, and head movements from side to side. Vowel sounds are audible and meconium may be passed. The second stage is known as the period of decreased responsiveness. This period lasts from 60 to 100 minutes, and the newborn will either sleep or have a marked decrease in motor activity. During this time, the infant is pink and respirations are rapid and shallow, approximately 60 breaths per minute, but they are unlabored. Vowel sounds are audible and peristaltic waves may be noted over the rounded abdomen. The third stage is known as the second period of reactivity. This stage will last from 10 minutes to several hours. The newborn could experience brief periods of tachycardia and tachypnea, which is associated with increased muscle tone. They could also experience changes in skin color, mucus production, and meconium is commonly passed at this time. Most healthy newborns experience this transition regardless of the gestational age or the type of birth. Extremely preterm infants do not because of the physiologic immaturity. Okay, now we're going to independently look at some physiologic adaptations of each system. First on our list, we're going to discuss the respiratory system. Establishment of effective respirations is the most critical adjustment after the severing of the umbilical cord. Most newborns breathe spontaneously after birth and are able to maintain adequate oxygenation, but preterm infants often encounter respiratory difficulties that is related to an immaturity of the lungs. Nurses will monitor for signs of respiratory distress. The initiation of breathing will be discussed in detail in upcoming lessons. Next, we're going to discuss cardiovascular system. The cardiovascular system changes significantly after birth related to the infant's first breath. There will be a change in heart rate, sounds, blood pressure, and blood volume. The nurse will need to monitor for signs or risk for cardiovascular disease. The cardiovascular system changes will be discussed in detail in upcoming lessons. Now we have the hematopoietic system. The hematopoietic system of the newborn exhibits certain variations from that of the adult. Levels of red blood cells and leukocytes differ, but platelet levels are relatively the same. The infant's blood groups is determined genetically and established early in fetal life. We will discuss this system in detail in upcoming lessons. Okay, so now let's discuss the thermogenic system. Heat regulation is another critical aspect to the newborn's adaptations to extrauterine life. During the first 12 hours after birth, the neonate attempts to achieve thermal balance. An infant can experience heat loss. Through thermogenesis, the neonate attempts to generate heat. The nurse will monitor for cold stress and hyperthermia. This can occur even though it is less common than hypothermia and will need to be corrected. We will discuss the thermogenic system in detail in upcoming lessons. Okay, now the renal system. At birth, a small quantity of urine is usually present in the bladder of a full-term infant. The key thing to remember is to maintain fluid and electrolyte balance, and the nurse will monitor for signs or risk for renal problems. We will discuss the renal system in detail in upcoming lessons. Okay, now the gastrointestinal system. The full-term newborn is capable of swallowing, digesting, metabolizing, and absorbing proteins and simple carbohydrates and emulsifying fats. The GI system includes the process of digestion, stools, feeding behaviors, and the nurse is going to monitor for signs or risk for gastrointestinal problems. We're going to discuss this in further detail in upcoming lessons. Now we have the hepatic system. The infant's liver plays an important role in iron storage, carbohydrate metabolism, conjugation of bilirubin, and coagulation. The nurse is going to monitor for signs or risk for hepatic symptom problems, and we're going to discuss this in further detail in upcoming lessons. And the last physiological adaptation I want to discuss is the immune system. The immune system of the neonate is developed during gestation. It's transferred from the mother during the maternal circulation. The nurse is going to monitor for signs or risk of infection, and we're going to discuss this in further detail in upcoming lessons. Okay, so let's briefly discuss effects of cold stress. When an infant is stressed by cold, oxygen consumption increases and the pulmonary and peripheral vasoconstriction occurs, thereby decreasing oxygen uptake by the lungs and oxygen to the tissues. Anaerobic glycolysis increases and there's a decrease in PO2 and pH, which leads to metabolic acidosis. It's important that nurses are aware of the newborn's temperature. This other image indicates the action of the liver and the formation and excretion of bilirubin. Continuing with physiological adaptations, I want to discuss the integumentary system a little bit more. All skin structures are present at birth. The epidermis and the dermis are loosely bound and extremely thin. The vernix caseosus fuses with the epidermis and provides a protective covering. The integumentary system will include sweat glands, desquamation, Mongolian spots, nevi, and erythema toxicum. The nurse will monitor for signs or risk of integumentary problems. The integumentary system will also be discussed in detail in upcoming lessons. The reproductive system will differ between male and female. Both may experience swelling of breast tissue. Nurses will monitor for signs and risk of reproductive system problems. The infant may experience swelling or bruising of the genitalia related to a traumatic birthing process such as a breech birth. The image to the right provides depiction of this incidence. The reproductive system will also be discussed in detail in upcoming lessons. The infant's skeletal system undergoes rapid development during the first year of life. At birth, more cartilage is present than ossified bone because of cephalocaudal development. The newborn looks somewhat out of proportion. The nurse will assess for caput succedaneum, cephalohematoma, and subgaleal hemorrhage. the vertebral column of the spine, and any signs or risk for skeletal system dysfunctions. We're going to discuss this more in detail in upcoming lessons. The neuromuscular system is almost completely developed at birth. The nurse will assess for any abnormalities of the neuromuscular system. The newborn will have many primitive reflexes. We're going to discuss this further in upcoming lessons. Moving along, we're going to discuss behavioral characteristics. The healthy infant must accomplish behavioral and biologic tasks to develop normally. Behavioral characteristics from the basis of the social capabilities of the infant will experience a sleep-wake state. The healthy infant will differ in their activity levels, feeding patterns, sleeping patterns, and responsiveness. In the early newborn period, infants tend to alternate periods of sleep and wakefulness that resemble their fetal inactivity and activity patterns. Infant responses to environmental stimuli and to their caregivers depend on the infant's state or state of consciousness. Other factors influencing behavior include the gestational age and level of central nervous system maturity, which can affect infant behavior. Time such as time elapsed since birth affects the behavior of infants as they attempt to become organized initially. Stimuli affect the behavioral responses of infants, and medication given during the birthing process have not been known to cause any effects at this time. Sensory behaviors from birth. Infants possess sensory capabilities that indicate a state of readiness for social interaction. The sensory behaviors include vision, hearing, smell, taste, and touch. We're going to discuss in detail in upcoming lessons. The nurse will assess for any abnormalities. And then we have response to environmental stimuli that include temperament, habituation, consolability, cuddliness, irritability, and crying. We're going to discuss these in detail in upcoming lessons. This concludes a brief overview of the physiologic and behavioral adaptations of the newborn.